Good afternoon and welcome to the COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights. Minister of State for Health says close to 20 billion naira has been paid to health workers, including striking resident doctors. Association of Resident Doctors leadership deny receiving such payments as they resume dialogue with the federal government today. And final clinical trials for a coronavirus vaccine developed by AstraZeneca and Oxford University put on hold after participants suffered suspected adverse reaction in the UK. Well, if you thought the coronavirus was slowing down in Nigeria, think again, as the Nigeria Center for Disease Control announced 296 new cases of the virus. This increased the number of active cases by 187 from yesterday, putting cases in admission at 11,055 after 105 persons recovered in the last 24 hours. As at today, total confirmed cases stand at 55,456. 43,334 persons have recovered, and 6 more deaths leaves the death toll at 1,067. A breakdown of the new cases shows Plateau State leading with the highest at 183, followed by Lagos State at 33 cases. The FCT recorded 25 new cases, 16 were recorded in Ogun State, 7 in Oyo, 6 in Ekiti, 5 in Kwara, another 5 in Ondo State, while 3 each in Imo and Anambra, Nasarawa as well, and 2 cases each in Rivers, Gombe, Edo, while Akwa Ibom recorded 1 case. Plateau State in recent times has had a daily rise in cases, topping the list of states with new infections. But according to the state government, it is due to backlogs. And a statement by the Plateau Commissioner for Information and Communication says the state has 3 testing centers and there is increased community testing ongoing. Over 1.3 million confirmed COVID-19 cases have been confirmed on the African continent, with more than 1 million recoveries and over 31,000 deaths. Now, the Minister of State for Health, Senator Oloronimbe Mamora, today told the nation that 20 billion naira has been paid to health workers so far. Some of the beneficiaries include mental health professionals, medical laboratory scientists, and resident doctors. He was speaking on our breakfast program, Sunrise Daily. We'll bring you that report shortly. But the National Association of Resident Doctors, they resumed dialogue today, or are to resume dialogue today, with the delegates from the federal government. Now, the president of the association, Dr. Lee Sekumba, he has reacted to the claims that 20 billion naira had been paid to health workers, saying that it is untrue. In a conversation with Channels Television this morning, he said the only payment he can confirm is the 2 months hazard allowance, which has been paid to resident doctors out of the 6 months promised by the federal government. According to him, one thing you must know about government is that they exaggerate too much. When they do a little, they make it look like all promises have been met. As resident doctors, we are not interested on the billions they paid. All we are asking them is to pay our outstanding allowances. The resident doctors have been on strike since Monday to protest what they term the refusal of governments to meet up their obligations to them. As the National Association of Resident Doctors in Nigeria begin the nationwide strike Monday, their counterpart at the Baro Diko Teaching Hospital and other government-owned hospitals have shunned the strike called by the association. President of NARD, Dr. Saeed Mohammed, who gave the reason why they will not be part of the strike, says the Kaduna State government has domesticated the Residency Training Act, which entails full sponsorship of residency training for medical doctors and their well-being. He, however, called on the government to kindly fulfill and implement the other outstanding issues that have been agreed upon by both parties. On his part, the Chief Medical Director, Baro Diko Teaching Hospital, says that state government is not unmindful of the outstanding agreements that it has reached with the resident doctors.
We now use this opportunity to appeal to the state governor to ensure full implementation of the Residency Training Act. Besides, we have other issues that are pending. There is this 10% that was deducted from our salaries. And he promised, of course, he's going to refund it. That makes it 20%. We use this opportunity also to appeal to him that he should use this gesture to ensure that those 10% are paid.
We here in Borodiko Teaching Hospital, we have our own peculiarity, being a state teaching hospital. Our residents are fully on ground, they're working, they have not joined the strike, and they have not indicated their willingness to join the strike because we have our own peculiarity. Agreed, we're all aware of the grievances of the national ARD, that is the NAT, which virtually most of them we have taken care of here in Kaduna State. But the other smaller gray areas that remain, we're still discussing with the local chapter of ARD to see how we can resolve it amicably.
The fight to contain the coronavirus pandemic is getting a boost as Christian Aid, a non-governmental organization, pledges its support to the federal government in its bid to reduce the spread of the virus in the country. Addressing a news conference in Abuja, the country director of Christian Aid, Mr. Charles Uzie, explains that the organization, with the support of the British government, will spend $1 million within the next 6 months to support the federal government's effort to contain COVID-19. He adds that personal protective equipment will soon be distributed to hard-to-reach communities in Benue, Borno and Kaduna states, in addition to the provision of renovated water points aimed at promoting the culture of hand washing. Now, following the lack of cooperation by members of the public with the safety measures for prevention against COVID-19, the Niger State government says it has changed its strategy enforcement of the protocol of the risk communication strategy. The Commissioner for Health stated this in an interview with our correspondent in Minna, the state capital, where he also gave an update on the spread of COVID-19 in the state.
As of today, we have 244 cases. You will recall that some few weeks back, His Excellency directed that everybody in the council at that time should be screened, where we have 2 positive cases. The other day again, His Excellency, the Deputy Governor, directed the staff of his office, because there was also some level of violation, should also be screened, which was also done, and there were 2 positives. Yes, we know that there are what we call carriers. Carriers are those that can harbor the disease, but it doesn't do them anything, but they can infect others. So again, we have discharged our last set of patients on admission about 3-4 days back, but that does not mean that we'll close down our isolation center. They remain active until when this disease is over. However, there are some level of protocols that are being changed on daily basis. For instance, recently when you have a positive patient that is symptomatic, he doesn't need to be admitted into the isolation center, especially if he can self-quarantine and obey situation. Our molecular lab, definitely because of modifications and then of course physical space constraint, there are some little delay, but we hope that within the next few days that laboratory will be put to finish, and we are ready to commission it very soon.
Well, for more on the striking resident doctors, Dr. Itoha Oaku is the chairman, Association of Resident Doctors, Lassuth chapter. She joins us on the program. Thank you for joining us. I'd like to begin by asking your response to what the Minister of State for Health has said, saying that 20 billion naira has been paid to health workers so far.
Yeah, thank you very much. Good morning. Well, it will be difficult for me to verify those claims. These are figures given by the Minister for Health, and it's going to be very, very difficult for me verifying those claims. But like the president of the Nigeria Association of Resident Doctors have earlier said, we are only aware that 2 months out of the 6 months promised for the COVID-19 inducement allowance have been paid. That's all I can say with respect to the Minister for Health.
It's been a long list of demands in terms of some of the conditions that NARD has been asking for. But we also know that, take for example, Kaduna State today, some of the resident doctors said they were not joining, and this is because the state government has met some of those conditions, like the Residency Training Act, which has been domesticated. For you in Lagos State, is there anything that the state government has done differently?
Okay, thank you. For us in Lagos, we've been having several meetings. It's all about meetings. We had the Salary Disparity Committee that was set up. We had several meetings with them. But as we speak, nothing concrete has come out of it. For the COVID-19 inducement allowance, we've not had any meeting whatsoever to that effect. So there's really no agreement on ground in Lagos for the health workers or for resident doctors with respect to that, not to talk of implementation. For the Medical Residency Training Act, the process is ongoing. We've commenced something, but it's still at a very early stage. It's yet to get to the head of service office, where from there is meant to get to, Mr. Governor for him to intervene in ensuring a smooth and quick domestication of the act. So it's still quite early. And the last thing, which has to do with the residential quarters, which actually our demand here in Lassus, residential quarters, we've talked about designs, we've talked about the plans, okay, but no land, nothing concrete, no tangible commitment from the government to say, okay, this is the area that has been earmarked for such a project. So, it's a lot of meetings, yeses, and nothing tangible from, the Lagos State government.
So the government has talked about lean resources, especially the fact that we're fighting the coronavirus pandemic, and we have different sectors of the economy that are also suffering. Don't you think that, perhaps the association as well can see reason from that angle?
Okay, I would to agree partially, okay, with you if the government really is sincere with, if we are sincere with ourselves, because we form the government really. And I will say that you don't take care of your personal needs and you leave critical needs such as the health sector, left hanging or to dilapidate. And we are saying this not just because of our own personal needs as well, because at the end of the day, it's the patient's welfare that we are looking at. So I think there should be a balance when we talk about the resources that are available or not available. What do we channel these resources through? Is it for the posterity of our people, or just for, the personal needs of a few? I think these are things we really need to look at. And if we are sincere with ourselves, we know that government needs to do the needful when it comes to health. And just to say that for resources being scarce, really, how scarce is it when we still can afford so much in terms of what we hear on the news, And really, I don't want to go into that.
All right. An economist has said that Nigeria perhaps is suffering from some comorbidities which has been exposed by the pandemic. But we hope that the meeting today is fruitful. We'd like to thank you, Dr. Itoha Oaku, Chairman, Association Resident Doctors. Lasso, thank you for joining us.
You're welcome. Thank you for having me.
We have more on the COVID-19 updates when we return. Please stay with us. Welcome back. Mr. Emmanuel Astika is now free from COVID-19, but for him, the experience at the isolation center is not one to forget in a hurry. According to him, it all began when he had difficulty in breathing, and so he went for a COVID-19 test and became positive. But today, he has returned to work after testing negative to the virus.
I caught it. It was almost like a death sentence. So one had to, in so many ways, try to muster the courage to be able to try to defeat the disease. And that was largely emotional. Then, of course, I had superlative care in the isolation center. I was met with absolutely top-notch professionals. Of course, again, it's not that there's a tablet or there's a cure for coronavirus. What my treatment procedure was that they tried to build up my immunity. So we had some antiviral drugs that we were taking at the time, a lot of vitamin C's, and then they tried to attack a lot of the symptoms that I was having at the time. When I was told I had tested negative the third time, I wasn't even sure if I was ready at the time to leave the isolation center, to be honest. So for a couple of reasons. One was that my symptoms had not totally disappeared. So I still had I still had a bit of gastroenteritis. And then I was secreting excess saliva. And then I was very weak, of course. So
Well, a survivor there, Dr. Mr. Jalili Kalani. He is a clinical pharmacist, also the Assistant Director, Pharmacovigilance Vigilance Services, National Hospital of Abuja. He's also the Chairman, Pharmaceutical Society of Nigeria, FCT branch. He joins us from Abuja studios. Thank you for joining us on the program.
Thank you for having me. Good afternoon.
All right, we heard from the COVID-19 survivor there, Emmanuel, talking about his experience. You're also one who works with one of the isolation centers in the FCT. Give us your experience as to the condition of patients there.
Thank you very much. The patients there that are brought to the isolation center at National Hospital, so depending on the various types of comorbidities they have, so they are attended to and they are given first-class treatment. So some had very severe COVID symptoms and some have used to have very mild symptoms. So they are treated based on the symptoms that are presented, and then the treatment regimens are followed, and then the protocols are very fantastic. And then we have not been having challenges, and so many of them have been discharged so as they come. So it's been very nice working at the isolation center in the National Hospital.
If you were to share with us some of the treatment regimen, because you say that they are effective and they have been working, how would you describe them?
The treatment regimen they're okay. Maybe just for, I may not be permitted to review the treatment regimen, but they are very good regimen. They are the normal drugs that we used to have. Some of them
Mr. Kalani, I asked that because
yes?
the survivor talked about building the immune system, and that's what they gave him a lot of, building that, and then some of the other antiretroviral drugs that he took.
Yes, the drugs that are used to build immunity, so drugs like zinc and then vitamin C, high strength, so they are being used. Then you also have the other drugs, the anti-retroviral drugs are given to some of them, and some of them are given the chloroquine or hydroxychloroquine, so, and then antibiotics. So I'm just trying to be very careful because some people, when they know the names of the drugs, they get confused. They even confuse people more. Some people will say, you are just being treated for malaria. So the treatment protocol for COVID has its own regimen. So yeah, it may resemble, some of the drugs that are being used are also being used to treat other disease conditions, but it doesn't mean that it is those conditions that they thought they were being treated for. So, but by and large, so people have been getting well with the treatment protocol at our center in National Hospital, and we don't have problems. And also the staff that are deployed there, they're also coping well, so nobody has been infected with COVID.
Okay, I wanted to quickly ask about the efforts of the FCTA to the safety protocols. What have you observed? And, you know, if you were to recommend something that people can do, should continue to do to keep the virus at bay, what would it be?
So I will just implore the public to continue to cooperate with the government, especially the PTF, regarding the protocols, the issue of physical distancing, wearing the face mask, face shield, you know, and people should not, because there are people who are still doubting whether COVID is real. It is real because we have been managing patients in our center. So we should try to stick to the protocols wherever we are. So just like the slogan that has been going on, wear it for me. So yes, protect yourself and also protect others. So we should not actually underrate all these protocols because they are actually for our own safety. We do not want to be infected and we do not want to infect others. So we should use hand sanitizers or hand washing, as the case may be, wherever they are available. In fact, whenever we are entering any office or any place, we should make sure that we sanitize ourselves, and when we are coming out, we sanitize ourselves. So all these protocols, we are being trained every time to just remind us so that even as health workers, we do not actually let down our guards. So the public too should not let down their guards. They should make sure that they do not allow this thing to spread so that we can just curb this disease on time and then we can go back to our normal activities, maybe in some couple of months, God helping us.
Thank you so much, Mr. Jalili Kelani, Clinical Pharmacist, Assistant Director, Pharmacovigilance Services, National Hospital, Abuja. Thank you for joining us on the program.
Thank you very much.
Final clinical trials for a coronavirus vaccine developed by AstraZeneca and Oxford University have been put on hold after a participant suspected to have adversely reacted to it in the UK. They described it as a routine pause in the case of an unexplained illness.
AstraZeneca plc has put on hold on the late-stage trial of its highly anticipated COVID-19 vaccine candidate after a suspected serious adverse reaction in a study participant. However, a spokesperson says that the standard review process triggered a pause to vaccination to allow review of safety data. The study is testing a COVID-19 vaccine being developed by AstraZeneca and the University of Oxford researchers at sites, including the United States and the United Kingdom, where the adverse event was reported. In reaction to this latest development, Britain's Health Secretary Matt Hancock says that safety was the priority.
Well, obviously, I'd rather this went completely smoothly. However, we're absolutely clear that safety comes first with the vaccine. So there's been a pause while they investigate an incident. And this has happened before, and then the pause has been lifted. But it just shows how much of an emphasis we put on the safety of the vaccine, even though, of course, we're all desperate to see it work.
Meanwhile, Australia says it is not concerned about AstraZeneca's decision to put on hold its COVID-19 vaccine trial as daily cases nudged higher in the country's coronavirus hotspot. The country on Monday said it would get the first doses of AstraZeneca's vaccine in January 2021 if trials proved successful after reaching a preliminary deal in August.
With regard to what would happen to our deals or whether we would walk away or so on and so forth, I don't think we're even close to thinking about that sort of thing with this single event.
And elsewhere, Jordan has resumed regular international flights after being suspended for nearly 6 months because of the coronavirus pandemic. Officials say Queen Alia International Airport will initially handle 6 flights a day before expanding to ensure that airport authorities can enforce strict social distancing and other health rules. Jordan's King Abdullah took a tour of the airport on Wednesday and was briefed on the new measure being put in place.
For further updates, you can take a look at our website. It's channelstv.com. It has the latest updates on the pandemic. You see Mexico warning a setback in the test. We understand that Mexico and Argentina are also part of the vaccine research. That's the program this afternoon. Thank you for watching. I'm Millicent Nwonka. Stay safe.